Hi, I'm Dr. Sarah Souls. I'm one of the naturopathic doctors here at the Integrated Health Clinic. My practice is a combination of cancer care, women's health, and seniors health. Why should women think about breast health? Well, approximately 1 in 8 women will be diagnosed with breast cancer in their lifetime, and 1 in 34 will die from it. So breast cancer is a very prevalent disease and has huge impacts physically, mentally, and financially on women, their families, and society as a whole. We know that early detection dramatically improves survival. So staying on top of screening, being breast aware, and using dietary and lifestyle factors to reduce risk are all part of a very well-rounded breast health plan to lower risks of breast cancer and to improve early detection. It's never too early to start thinking about your breast health and to do things that reduce risks of cancer. There are many very safe dietary and lifestyle interventions that not only reduce the risk of breast cancer, but also many other chronic diseases. For example, quitting smoking and alcohol reduction are foundational, and naturopathic doctors are very well equipped to help support these. Mammograms are the standard for screening for breast cancer, and not only can they detect masses that are cancerous, they can also pick up on pre-cancerous conditions like DCIS, which is at high risk of developing into cancer. Mammograms also can identify breast density. We know that having dense breasts alone increases risk of breast cancer, and unfortunately, this cannot be detected on physical examination. Naturopathic doctors can perform in-office breast examinations. We can also refer for screening mammography. In cases where we're concerned about a potential cancer, we can also refer for diagnostic mammograms and ultrasound. In certain cases, we can also order private pay hereditary cancer testing to determine if a woman is at increased risk of breast cancer because of inherited mutations in certain genes, such as the BRCA1 and 2 genes. Naturopathic doctors also have the luxury of time to sit down with patients and determine if there are other potential factors that are influencing their breast health. Things like hormone dysregulation, obesity, physical inactivity, high blood sugar and insulin resistance, and nutritional deficiencies like vitamin D. This is an important discussion that I have with any peri or postmenopausal woman who's interested in starting hormone replacement therapy. We know there is an increased risk in breast cancer associated with using HRT, particularly with the addition of progestins. Using vaginal or systemic estrogens doesn't seem to pose the same level of risk. So this risk depends on which type of HRT you are using, as well as how long you are using it for. In many cases, the potential benefits of HRT, including the positive impacts on quality of life, protection of bone health, cardiovascular health, and cognitive health, outweigh any potential increased risk of breast cancer. This, however, needs to be a very individualized discussion and decision based on each person's personal and family history, as well as their overall health goals. In any person with breast tissue who's on hormone replacement therapy, I do at least recommend staying very breast aware, staying up to date on screening, and of course, seeing their doctor for further assessment if there are any concerning changes in the breasts. So if you're interested in having an assessment of your overall breast health and starting things to reduce your risks of breast cancer, then book an appointment with me at the Integrated Health Clinic.